It is 100 years since Prohibition came into force in the United States, outlawing the sale of alcohol. It was derided as a public policy disaster. Eventually, it was overturned. Does banning things ever work? Welcome to Roundtable. And a very warm welcome from me, David Foster. A century ago, it was alcohol that was seen as the great scourge to be eradicated. Since then, we've seen a war on drugs and attempts to push people away from smoking. Are bans ever the answer?
Prohibition in America came into force in 1920 through the Volstead Act, and the ban on alcohol lasted nearly 14 years. Now, a century later, it is seen as proof that trying to ban drinking when it is already popular is not a good idea. Prohibition gave rise to organised crime, as mafia gangs made fortunes from bootlegging. Enforcement of the ban was feeble because it lacked popular support. According to one estimate, there were at least 20,000 illegal bars in New York City during Prohibition. Instead, in most places, governments try to dissuade people from drinking by making alcohol more expensive through taxes and restricting its sale and advertising. Such policies can work. In England, smoking rates have declined since it was outlawed in all indoor workplaces more than 10 years ago. But are bans ever the best way of protecting the public?
Very pleased to say today with me at the round table we have Niamh Eastwood, who's Chief Executive of Release, who believes that the most vulnerable in society are disproportionately impacted upon by current drugs laws. Axel Klein with us here in the studio too, social anthropologist with a particular interest in drugs issues. On the line from Vermont in the United States, Dr. Carney, who discusses alcohol use and abuse from a public health perspective. And from Budapest, we have Frank Furedi, author of Culture of Fear, who believes that bans should only be used to protect children or public security. Great to have you all with us. Let's start off with Prohibition. And Frank, 100 years on, it was abandoned. Did it ever work in any way?
Well, Prohibition only had one good result, which was the invention of cocktails, which I quite enjoy, which happened because there was such little alcohol around that people had to make do with minimal amounts by putting in juices and other things. But I think the main achievement of Prohibition was to industrialize crime, and it really did help organized crime to have a real boost as a result of the difficulties of getting hold of alcohol. And it seems to me that what's important about Prohibition from a sociological point of view is that it's a very good example of a kind of virtual signaling where you're using expressivist laws, where you're in a sense, trying to change the moral temperature, the moral climate, in a way that invariably has effects that are totally unintended. And I think the unintended consequence of the Prohibition was to give a real boost to organized crime in the United States. And in that sense, it's a paradigmatic example of what happens when you use these expressivist modes of banning things in society.
The driving force of Prohibition, one article I've got out said, was various religious organisations who hoped, among other things, Axel, that it would raise the overall amount of piety in America, which only goes to demonstrate that what you want will often achieve the opposite effect.
Arguably. An interesting sort of transition that also occurred with Prohibition is that it's driven originally by religious organisations who initially define alcoholism or alcohol use as a problem. But it is then taken over by public health officials. It becomes a medical issue after a while. And you see this transition from the religious sphere to the medical field. And then in the next step, in the middle of the 20th century, it gets taken over by law enforcement, where alcohol and drug issues are no longer primarily a health problem, but a crime issue. So it passes from one professional group to the others. And where that leaves public piety, that's just up in the stars.
OK, Jan, since we've just mentioned, or Axel's just mentioned public health, let's go into some of the things that I've read also about Prohibition. Wife beating and lack of family support decreased by 82%. Deaths due to cirrhosis, the liver disease, decreased by 50%. Disorderly conduct decreased. County hospital death rates were historically low. So banning alcohol, although it cost the government, it's reckoned, 11 billion in lost tax revenues, it did have a beneficial health effect, yes or no?
Yes, there were measurable, documented improvements in public health, reduction in alcohol-related deaths and alcohol-related consequences. But as previously noted, there were many, many societal unintended consequences, such as organized crime, that really, if you look at the policy as a whole, you get a different picture.
So how do you benefit, Niamh? I know your special area is drugs use, but how do you benefit perhaps an increase in public health with the level of sophistication it gives to organised crime here? Banning it might be good for people's well-being inside, but not necessarily for the law enforcement agencies.
Well, I think this applies both to alcohol prohibition and drug prohibition, and we have to remember alcohol is a drug as well, so I just want to put that out there, is that, yes, there are public health harms with substances, alcohol in particular, because of the damage it does internally to the organs. We actually see that less with the illicit substances. But also there are benefits to consuming all types of drugs, and I think we forget the beneficial nature of alcohol and illicit drug use that can occur in many contexts within society, whether it's relaxing in the evening or it's social events. So there can be positives. And at the end of the day, it really is about what are the harms related to prohibition. And what we see significantly is the level of violence that occurs within markets that are subject to a prohibitive regime is extreme. You just have to look at countries like Mexico, for example, where the war on drugs really was ramped up in 2006 with militarization. 200,000 people dead there since 2006.
Okay, this is now open to everybody. I've had a chance to bring you all in individually. Why did it not work? Who wants to start on that one? Frank?
Well, I think there's a very important point here, which is it seems to me that it's not a question of balancing costs and benefits. Banning stuff has the effect of infantilizing society. It basically suggests that people are too stupid or too childish to look after their own health. We cannot trust people to live in accordance with their own desires. And I think there's a kind of cultural cost which you cannot quantify, which comes when you begin to ban things. To give you a very good example, a very innocent example in many ways, one that comes to mind is Singapore, where they banned the chewing of gum, and where if anybody spits a gum out on the street, you get into really big trouble with the police. And I think that it sounds very innocuous. Who could possibly object to the state telling you as to what you chew and what you cannot chew? But it seems to me that when you have that kind of authoritarian impulse being institutionalized, and when people are treated as if they're just infants, there's a very, very heavy cost that I think we need to take into account. And that's the reason why I'm really against bans, because it basically tells us that we cannot trust each other.
Okay.
We need to have laws to do it.
Jan, I've got a question for you in just a moment, but I related to what Frank's just said, but I know actually you want to
So why doesn't
say
it
something.
work? Well, let's pedal back. Prohibition did work extremely well in the Soviet Union, and it also worked very well in China prior to the opening to a market economy. So if we have totalitarian and highly autocratic states, then we can really crack down on the distribution of commodities effectively. But in market societies where we have a capitalist engine of economic growth, the power of the market signals is such that you will, if the cost is right, always find somebody to supply it. And just to pedal back in time, there's a wonderful example from 18th century England, where you had a brilliant trade in tea trafficked in from France and the Netherlands, with shootouts between customsmen and hangings along the coast of Kent and Surrey. And it collapsed after the tariff on tea was lowered by Pitt the Elder. So we have to have our choice. Do we want an open society with a capitalist system, or do we want a totalitarian regime? And then
So how did it work from the Chinese and the Russian or Soviet perspective?
You don't let any products in, but you just have an additional queue. Next to the meat queue is the queue for psychoactive substances. It's just commodity shortage, together with hard autocratic authoritarian interventions.
Jan, I was going to come back to you with something in relation to what Frank said, and I'd made a note here. Is telling people how to behave, which effectively what this is, anyway in a civilized society correct, even when it comes to their health?
I think policies can be a very effective part of our public health efforts, but they have to be way more restrictive, not total bans. As an example, we know that one of the most effective ways to reduce alcohol consumption by young children is to raise the price and restrict advertising and some of the availability. So some of these restrictive policies have resulted in reductions in death and improvements in public health by looking at specific vulnerable populations and having a very limited policy in the area.
It's all about education, isn't it? Simple education. Tell people what's bad for them, let them decide for themselves.
It can be, but sometimes that's not enough. And if you look at the driving under the influence law, telling people it's not okay to drive while intoxicated simply didn't work. But if you look at some of the policies and laws that have been passed, you see a reduction in deaths of other people by some of these more limited restrictive policies in combination with education.
Equally, I would contend, and I know you want to say something, Niamh, I would contend that, yes, there are laws against drinking or driving under the influence of whatever it is, but the public has come to regard doing so perhaps as antisocial and taken it on board as well as being legally banned from doing so. But anyway, you wanted to say something.
And just to pick up on Jan's point about children and how we've been effective around public health messaging in relation to alcohol and tobacco, actually, these are both products that are legally regulated within the market, regulated tightly. When we compare this to the illicit drug market, the lack of regulations, if you like, the blanket ban of these drugs means that we have no age controls, no product controls, and so we put public health at risk because of the policy. So I think, it's not just education, it's healthy public health policies, having clear taxation laws, something that are absent levers in the current regime that we have for illicit commodities.
Jan, you mentioned driving under the influence of one of the things where a ban has been extremely helpful. I wonder if any of the rest of you yourself included, Jan, can think of other instances where saying, no, you cannot do that, has actually worked.
Seatbelts.
Okay, seatbelts. Frank?
Cigarettes, banning of smoking in public places, which has had the consequence of making it socially unacceptable. I think that's what's the critical element here.
And again, with seatbelts, it's not just yourself, it's your passengers and everything like that. And now it's become, we used to call it clunk click.
That's right.
In this country now, it is an automatic response. Now, I'm going to go through a few of the things here before we get on to drugs particularly. Apparently, if you live in Walnut City, California, you cannot wear a mask on Halloween without the sheriff's permission. Hartford, Connecticut, on the east coast of the US, you apparently can't kiss your wife on a Sunday. You mentioned chewing gum in Singapore, Frank. Frowning in Milan, and not walking your dog 3 times a day, apparently, in Turin. Now, those are more light-hearted examples, but it just shows that we as a society have a range of tolerance, don't we?
Mm-hmm. Absolutely. But the question is, does the policy work? That's the real question that we have to ask ourselves, whether banning drugs works. And we know from the statistics it doesn't. We just have to look at global consumption of drugs. The number of users has increased in the last 15 years by 46%, from 183 million in 2003 to 217 million in 2017. The idea that we continuously criminalize this population is really just a failed policy. And we look at all the harms that are associated, the violence, the health harms. In Russia, for example, which has a hugely punitive approach to drugs where you can't get access to harm reduction, 1 in 100 adults are HIV positive. I mean, these policies, this approach is causing huge numbers of people to die every day for different reasons.
Interesting, isn't it? This is something from 2016 that you helped pull together, a quiet revolution, drug decriminalization across the globe. And we'll talk about where easing up on bans has been a good thing. But there's one figure I took from this. California saved nearly £1 billion in the first 10 years of cannabis decriminalization. And the other figure I threw out there was how much prohibition had cost, and it was 11 billion. So you can actually see a taxation argument for this as well as a health one.
Absolutely. You can't just say, come back to the bans. I think we've got to distinguish between banning things or behaviors that harm other parties. That's why we ban guns, or have, in this country at least, have restrictions on certain issues, on driving speed limits and so on, because there's the potential to harm third parties. But when it comes to harming yourself, that's where I agree with Frank about the infantilization. And is that really the role of the legislator? And I think certainly not. We have to use other methods, persuasion, education, as was mentioned earlier, but not legal interventions.
So let's go to Jan again. Public health, when it comes to alcohol, I'd like to ask you your view on whether some of the laws should be more strict. But what about Niamh's argument about drugs and decriminalisation, that actually bring it out into the open is beneficial for society and public health?
Yeah, I would really not go broadly and look at all drugs as a group. I would say you have to look at the specific health effects. Say of nicotine addiction in young people. That's one of the issues with the vaping epidemic in the United States. Alcohol and its consequences on specific populations. In the United States, we're in the middle of a variety of state efforts to look at making wider availability of both medical cannabis and then decriminalizing cannabis generally. And I don't think we've yet established what some of those harms are. We do know that some states are seeing more driving under influence. That's a negative consequence for many people. I would not be comfortable generalizing a couple of drugs at this time.
Yeah, I think it's important that we distinguish the difference between decriminalization and drug regulation, legalization. So decriminalization is simply the removal of criminal sanctions for possession and other personal activities. And this is important because globally, 83% of all drug offenses that are prosecuted are for possession offenses. So this policy focuses disproportionately on the user, so it's not actually tackling the real harms of the market. I don't think it can tackle those harms, but it doesn't do that. It focuses on people who use drugs, and it focuses on a particular section of society, those living in poverty and people of colour. They are disproportionately criminalised for this activity. We just have to look at the most recent Conservative leadership election, where the majority of candidates
here in the UK,
leadership
of the Tory party, which is in government, etc.,
where the majority admitted to their drug use when they said it was a youthful indiscretion, something I don't agree with either, but are quite happy to perpetuate a policy that continues to criminalise tens of thousands of young people every year in this country. So our view is decriminalisation is the first step, and then you start to look at regulatory markets for each of the drugs. And each drug will require a different response.
This is a social question, but it applies to all of us because we think about these things, whether we're experts or not. So Frank and Axel on this one. Frank, are we becoming more tolerant as a society when it comes to these sorts of things than we were 100 years ago?
I think we're becoming tolerant towards certain things and less tolerant towards others. So, for example, if you take bans as a generic activity, we're now in the business of banning advertisements. We ban ads that show women who are very thin on the grounds that it sends the wrong signal and creates the wrong body image for young girls. But at the same time, we are kind of complicit in the fact that we know that drugs are widely used. I know the parents that I talk to all know their children use drugs. They kind of laugh about it. I went to a dinner party recently in London where the parents were boasting about the fact that they were the first people to give their children a joint so that they wouldn't get it from a drug dealer, and they thought that was a very clever way of managing their children. So there's a kind of complicity rather than tolerance for a lot of these things, and I think that the only way out of this ultimately is to create a different market in drugs, where it's taken out of the hands of the criminals, organized crime. It becomes more widely available in a kind of proper, more healthy, sort of setting, and where, in a sense, what we do is we warn people about the dangers of drugs, and we educate people about the difficulties that it will pose for their lives. But at the same time, we don't make drug taking into a crime. We treat it as an addiction, just like any other addiction. And I think that would be a civilized way forward.
Okay. Axel, I wanted to ask you a similar sort of question.
Oh, yeah.
Tolerance.
The tolerance, I agree with Frank. Certain things I don't think we ever become more tolerant or more open or liberal. We just choose our topics. And that's where I agree with what Jan was saying earlier. We should take a drug-by-drug approach. But I would like to go further. I would like to stop using the term drugs, because it just sends the wrong message, and it's such a loaded term.
What are they?
We should go by substance, because alcohol, as Niamh said, is a drug, but it's never included in the drug policy debate. It's outside all the international regulations. It's outside the drug policy regime. So is tobacco, although it is now sliding in, and we're in this interesting situation where we have these two commodities and different directions, where cannabis is becoming socially acceptable and turning into a medicine, whereas tobacco is already on the brink of becoming illegal in countries like Australia, for instance. So we should take a substance-by-substance approach. And if we have regulated market, and we need to have not just decriminalization, we need to have legalization within a controlled market, we can then ensure, and society is, after all, self-correcting, people are not suicidal, that they are consumed in a sustainable, i.e. a least harmful manner, by reducing potency, for instance, and by doing it in a social context.
Okay. Jan, I want to come to you in just a moment. Excuse me if I talk to Niamh about decriminalisation here. Around the world, you've had a chance to look at societies where this has happened, and are there any downsides that you can see?
Well, I think there is some jurisdictions that adopt this approach that do it as a way to impose more punitive laws, if that makes sense. So Russia, surprisingly, has got a decriminalisation policy, but the thresholds, and the thresholds, when I mean thresholds, it's the amount of drug that you're caught with in order to benefit from a non-criminal response, are so low that what happens is that most people who are caught are then subject to really harsh sentencing. So it doesn't work. But where it does work, and in many countries it does, and this is where it is coupled with public health responses, and I mean public health in the broadest sense, including education around how to use drugs safely, we see profoundly positive outcomes. So improved health outcomes around physical and mental health, a reduction on criminal justice system, reduced police burden, reduced recidivism, because we know that once we criminalise someone, they are much more likely to come back into the criminal regime, criminal justice framework. Finally, what I'd like to say is about drug-related deaths. In the US, in Canada, and in the UK, we have a drug-related death crisis. You look at the countries in Europe that have decriminalised, so Czech Republic, Portugal, their drug-related death is 4 per million of the population. It's 76 per million in the UK.
I'm only cutting you short because of
fine.
time.
Go for it.
Jan, I wanted to ask you, is it a vive qui vive situation? In other words, you have to be tolerant of anybody and whatever they want to do? Or do you say there comes a point when we have to prohibit something? In other words, if the alcohol situation, from your point of view, gets too bad, do we have to place further restrictions on it?
I think we have to look at what the substance is, what are the harms, and why we worry about them. I'm very worried about alcohol, tobacco, marijuana use among our young people. The rates are too high. We haven't figured out how to prevent it totally. And the perception of risk is low. That tells me that education programs for kids, and in some cases restrictive policies, but limited policies, not like bans we were talking about with prohibition, to prevent young people from experiencing those harms, dying of a motor vehicle accident, getting a sexually transmitted infection, limiting their brain development, on and on. Things that are going to harm them for the whole life. I think we have to look specifically and at evidence of what works for that specific population and protect our young people.
Frank, I see you're dying to say something. We are coming towards the end of the show. Please go ahead.
Well, I just think the really important thing is not to look for ways and means of banning things, but rather to look at what's driving people to adopt behaviors that we think are self-destructive, or even more importantly, are destructive for others. And it seems to me that banning things is just like an easy option. You kind of press a button and you think you've done something. Whereas a much more creative approach is required that tries to change the cultural attitudes, that tries to get people to understand that they can have a better life and we can provide the provisions for people to have a better life. So instead of wanting to get strung out week after week after week, they understand that if they stay clean and if they don't do any drugs, they can make things happen and transform their lives. And I think very often we forget the fact that it's the conditions within which people live that often drives people towards some very, very destructive, harmful forms of behavior.
Final word, actually, if I may. Will we ever see prohibition again?
I hope we can deconstruct it, but in order to do so, we first of all need to deconstruct the term drugs, and we also need to renegotiate the relationship between citizen and state.
Are we more pious, as the religious organisations wanted us to be when they pushed for prohibition?
Maybe we're proudly and equally hypocritical.
And what do you think, finally, Niamh? More pious, more understanding, more tolerant?
That
way to
is
go.
a complex question with complex
You have 5
factors.
seconds.
I think definitely we're seeing a movement in this area. We are seeing states across the US regulating cannabis. We're seeing countries doing that. I think the final thing I would say is criminalization fundamentally acts against public health. People who need support don't seek that support when they are at risk of criminalization. So a failed policy needs to be reformed, and I think we're sensible enough to do that now.
Okay, prohibition 100 years on. Should we ban anything? Thank you very much indeed, Niamh, Axel, Frank, and Jan. Appreciate your time very much indeed. Great to have your views. Do send them to us as well at our YouTube channel. That's TRT World YouTube Roundtable. From me, David Foster, and the team. For now, thank you for watching. Hope to have your company next time. Goodbye.